Good morning. I'm going to talk about medical education number one. A. Medical education in the UK. Medical education in the UK covers undergraduate education, 4 or 5 years at medical school, the section of a university responsible for medical education. A 2-year foundation program, which provides training for new doctors after graduation through a series of placements in different specialties. Postgraduate training, which doctors take to become GP or consultants. Senior specialist, often delivered through college for different specialties, for example, the Royal College of Physicians. Continuing professional development in the form of courses and seminars which doctors undertake throughout their working lives to keep up to date. B. Extract from an undergraduate perspective. The MBCHB, the Bachelor of Medicine or Bachelor of Surgery, is a 5-year undergraduate medical degree course. Most of your learning takes place in a small group. The main components are core year 1 to 3 an integrated program of clinical and scientific topics mainly present through problem-based learning (PBL), where you work with other on a series of case problems. Student selected models SSMS allow you to choose from a menu of subjects such as sports medicine, or even study a language as preparation for an overseas elective. A hospital attachment of your own choice between years 4 and 5. Vocational studies and clinical skills. This component prepares you for the clinical skills required for contact with patients from year 1 of your course, throughout periods of practical training where you are attached to a hospital, department, or general practice. Clinical attachments, years 4 and 5. A series of 4 weeks clinical attachments in medicine, surgery, psychological medicine, child health, obstetrics, and gynecology, and general practice. A student view. Ellen, a medical student, describes her course. I'm just finishing my first year of medicine. What I like about this course is that you are involved with patients from the very beginning. Even in our first year, we spend time in hospital. Much of the course is PBL. We have 2 hour sessions a week where we work in groups of 8 to 10 solving clinical problems. We decide together how to tackle the problem. Look up books and online sources, make notes, and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students has had lectures with the whole class, taking notes from lectures from 9 to 5. But now it's mainly group work, although we do have some lectures and seminars where we work in a small group, which with a tutor. I like all of it, even the dissection. We get to cut up cadavers from the second month, of course. Thank you. Now I'm going to read the exercise. 11.1. Match these activities to the stage of medical education in the UK, giving in a opposite A. 1. Dissecting cadaver, preclinical years. 2. Keeping along surgical procedures, observe and perform clinical years. Working for 4 months in accident and emergency to experience the specialty foundation training. Taking a 4-week attachment in obstetric and gynecology, clinical years. Taking an online course and recent developments in cardiovascular disease, continued professional development. Complete the sentence. Look at B and C opposite to help you. Just before their final year, students have the chance to take an active in a hospital of their choice anywhere in the world. Problem-based learning contrasts with an approach where each subject is taught separately. These days, lectures are often interactive with regular opportunities for the students to ask questions. In clinical training, students learn how to treat and manage patients. A student selected company can be a topic for outside medicine, such as foreign language. Dissection of cadavers is an important part of the anatomy component. The university at the University of Edinburgh is one of the oldest in the UK. She's a consultant at the Royal, one of the leading pediatric heart specialties in the country. The Royal College of Surgeons in Edinburgh dates from 1555. We have a tutorial each week where we discuss topic in a small group with our lectures. 11.3. Match each of these activities to one of the components of the undergraduate course described in B and C opposite. Julie spent 6 weeks working in a small hospital in the Himalayas. Elective. A group of students discuss together the possible reason for abdominal pain after meals in an obese 44 years old male. Clinical placements. A small group of students trace the pulmonary artery in a cadaver. Anatomy company. Otto spends a month working in the pediatric ward of the local hospital, clinical placement, and learns how to take blood from an elderly patient, clinical placement. Huma chooses to study travel medicine in his 4th year, elective. Thank you. Ahora voy a estar leyendo los ejercicios en español. 11.1. Empareja estas actividades con las etapas de la educación médica en el Reino Unido. Disección de cadáveres. Preaños clínicos. Mantener un registro de los procedimientos quirúrgicos observados y realizados. Años clínicos. Tomando un curso durante 4 meses en accidente y emergencia para experimentar este entrenamiento de citación, esto es entrenamiento de fundación. Tomar un curso en línea sobre los desarrollos recientes en cardiovascular, eso es entrenamiento continuo profesional. Entonces, completa las oraciones. Justo antes de terminar sus años finales, los estudiantes tomaron un chance para estar activos en el hospital así tener la opción de escoger cualquier hospital en el mundo. Los problemas basados en aprendizaje contrastan con, con cada materia separadamente. En estos días las lecturas han sido bien interactivas con regular oportunidades para los estudiantes tomar o decir preguntas. En el entrenamiento clínico, los estudiantes aprenden cómo tratar y manejar pacientes. Los estudiantes, la compañía para seleccionar estudiantes puedes tomar cualquier tópico fuera de medicina, así como un lenguaje extranjero. La disección de cadáveres es una parte importante para el componente de la anatomía. La Universidad de Edinburgh es una de las más viejas en Gran Bretaña. Ella es una consultante en el Royal, uno de los hospitales pediátricos, uno de los hospitales especializados en los corazones pediátricos en Gran Bretaña. El Royal College de Cirujanos de Edinburgh trata desde 1505. Nosotros tenemos un tutorial cada semana para discutir tópicos en un grupo pequeño de lectura. Empareja cada una de estas actividades con uno de los componentes del curso de pregrado. Julie pasa 6 semanas trabajando en un pequeño hospicio en el Himalaya electivo. Un grupo de estudiantes discuten juntos las posibles razones para un dolor abdominal después de una comida en un hombre obeso de 44 años. Paseamiento clínico. Un pequeño grupo de estudiantes rastrea la arteria pulmonar en un cadáver. Anatomía. Y Otto invierte un mes trabajando en la guardia pediátrica de un hospital local. Lugar clínico. Anne aprende cómo tomar sangre de una persona envejeciente, lugar clínico. Juma elige estudiar medicina de viajes en su 4º año electivo.